Hi guys, I'm going to show you today two moves that'll help with back pain. So I have a back injury right now, and for me what's happening, it's my sacrum and the joints around my sacrum, that triangle bone back here, are overworked or pulled a muscle there or a ligament or something. So that's, I'm having lots of pain here in the sacrum. But I think what's causing it is my pelvis is out of alignment and my hip flexors are really tight. And it's also causing my butt to be really tight. So I'm gonna use some tune-up balls. So 2 moves. You'll need blocks and tune-up balls. So the first one is with the tune-up balls, or any ball. I'm using tune-up balls in a net, but one ball works just as good. So you're gonna take the balls under your booty cheeks. So take the ball under your bum, and you're trying to find the spot where like all the muscles meet the hip joint. And there's a lot of little muscles here, so take your time and kind of settle into, it's a joint, it's a ball joint, and use the balls and settle, like go around the joint. So take your time, like first start here in one spot, try to get heavy on your exhale. So when we're in pain, we tend to like tighten and it's hard to settle. When something is hurting, no matter what it is, the shoulders start to creep up. So you're laying down and trying to have a long exhale and be heavier, more grounded. So I take the first couple breaths and just move the ball around and play with that. And then, like when I find a spot that feels good for me to stick with, you pin the ball and then start moving the limb. So taking the knee wide, which will change the sensation, and pulling it back in. So this is different. A lot of times when I'm doing ball stuff, I'm rolling a lot more. So right now, I don't want to do a lot of big movements. I am just trying to slowly let what's hurting relax. I'm trying to let the muscles stop clenching and holding and let them soften. So then I'll take the leg that's the knees wide and straighten it, and that'll also change the sensation. So I'm pinning the ball and moving the limb. So depending on your injury, like right now mine's really painful. I'm going very slow, but you can play with this leg moving up and around, up and down. So, experiment. Like that's the best thing about the balls is you can really make it your own and be really intuitive about it. So I just like shifted my weight up a teeny tiny bit, and it totally changed the sensation. Like I found the spot. It feels really good. So there's one thing. You take the ball under your bum, roll around. That's going to help back pain. Okay, now I have to move Lily. The second thing I want to show you is on the front, the hip flexors. Sorry, Lil. So you'll take the blocks or something similar. Get creative. I like that they're hard. You could probably use a pillow also, but I'll show you what's happening here. And we'll try to show you at an angle that's not awkward. Okay, so, and then I do want my balls here too. So I think what's happening with me, and I'm just telling you what's happening with me and assuming that there's somebody out there that might have the same issue, so this might help. So I think my pelvis is like tilted out of alignment. The blocks are gonna go right here on the pelvis, femur bones. I'm trying to use the blocks to push my femur bones back into the pelvis, like back towards my hamstrings. I tend to stick my ribs out and arch my back and push my femur bones, get pushed forward. These hip flexor muscles are so tight, but more on my left side. So first I'm gonna go with the blocks on my pelvis, and then I'm gonna add the balls just on the left side because I need a little bit more on that side. But I'll show you this way first. So the blocks are totally supporting my pelvis. You could even do the lower version. I feel like this is really good for somebody who is like hyper mobile, you know, is always arching their back. Their pelvis is always tilted. I don't know, I can't. Like you're not rounding all the time, but you're doing the other one. Your pelvis is always arching. If you're somebody who's rounding all the time, I don't think you would need this. This is for the other way. Anyway, so I'm shifting around. I'm just kind of playing with feeling where it feels supportive. You can just relax here and breathe. I'm going to take the ball under the left side because I think my pelvis is tilted. Well, I'm pretty sure it is. It does this. It's done this before. And the left side just needs a tiny bit more lift to help even out my pelvis. This is like intuitive. No doctor told me that right now. Somebody told me that like last year when this happened. So I'm feeling like it's very similar and it's just happened again. And so I'm digging the ball into my hip flexor, into the top of my femur bone and pelvis. I'm trying to just be heavy with my weight and use just the weight of my body to kind of, you know, basically massage and break up that tension. And pushing on my hip flexor like this, I could feel it in my low back. Like it feels really good on my back. So it's so interesting how we're all connected like that. And the front of the pelvis is causing the back pain. So I don't know if you can see, but I'm just kind of playing with more of this left side. Digging it into my hip flexor and feels really good. So there's 2 moves for you. Ball in the bum, open up your butt muscles if you're having back pain, and another way to open up the hip flexors. Like right now, I am not able to do a lunge, which is another way you can open up the front of your leg. So this is a really nice way to do that when you can't do like a regular flowing yoga sequence. It hurts to have my legs split. Like one leg in front, one leg in back. That's not feeling good on my back. So these are just some tools and tips, and maybe it helps somebody out there. Sitting a lot is gonna make it worse, and that's something I do. I do sit a lot. I drive a lot more than I used to. And then one more thing I want to show you is the pushing. I'm pushing the block into my femur bone, like pretty strong. Like I'm really trying to use the block to push the whole bone back into the pelvis where it should be.